So this is
That
really
might
helpful
be.
to know that this was a 5-year study, and we are dealing with brand new clients. These were not
Yeah.
existing clients people coming in. We're going to really find out from the get-go what their levels of well-being are, and their levels of attraction and sexual identity or self-concept and behavior, all of that from the start, and then measure it along the way. Dr. Nicolosi, what were the measures used, or the instruments used to measure the sexuality elements?
The measurement that was used was the SAQ by Santero, sexual assessment questionnaire, and that looked at thoughts, feelings, behavior, and identity. It specified all of them to give a more comprehensive approach. So they wanted to make sure there wasn't just behavior modification, because people can achieve behavior modification. You can do a behavioral thing and you can just change, but is it comprehensive? We don't know what an orientation is, as Dr. Pela mentioned earlier. The word orientation, a few problems. One is the term itself assumes that it's a stable construct that we're measuring. It's not necessarily a stable construct for all people. Number two is the term orientation is non-quantifiable. So if a person is 51% heterosexual, 49% homosexual, are they homosexual, heterosexual, or a bisexual? What if they're 75% heterosexual, 25% homosexual? At that point, are they heterosexual? Are they still bisexual? Are they homosexual? So if a term is not a stable construct, and if it's non-quantifiable, it's therefore unverifiable. It's an untestable hypothesis. So rather than creating an artificial, arbitrary construct, the components of sexuality were broken down into thoughts, feeling, behavior, identity, and then tracked in a more comprehensive way. And so that's what the SAQ was attempting to do.
Yes. What do we see as far as the results when it comes to the different dimensions of sexuality?
Yeah, so if we look at the sexual attraction fluidity, we were measuring attraction, same-sex attraction, opposite-sex attraction, and sexual identity on all those levels that Dr. Nicolosi had mentioned earlier, all those areas. And so as a global measure, all of those, we saw fluidity in all of those. So the opposite sex attractions increased statistically significantly. The same-sex attractions decreased statistically significantly, and then this sexual identity moved toward heterosexual.
Yeah,
statistically.
And actually, let me just jump in there real quick, because we need to clear up some confusion. Dr. Nicolosi, when we're talking about on a continuum, what do they need clarification on? Most people are going to think that this sort of therapy is gay to straight, like a light switch, but what we're doing is working on more like a dimmer switch. Right. So can you explain what we're looking at as far as realistic outcomes when it comes to shifts in sexual attraction and identity and behavior?
Yeah, we're not. So the critique, I guess the far left or the far right would think about this in terms of flipping a light switch. Like they would say, you're trying to make gays straight and flip the switch and make them different. And there are some people who would have a misunderstanding about this therapy, that that's the goal, or it's not about flipping a light switch. It's about rotating a light dimmer. It's about gradual change of varying degrees. Every person's different. This is not a cookie cutter conveyor belt kind of approach. Each person is different. And so we want to look at what is a meaningful change for that person. And in terms of a research study, what's the overall effect as a group?
I want to make it very clear. People often accuse your dad of throwing this idea of a gay cure. And I never heard him ever say that and present his work as this is a cure for being gay, that this will change you radically, and that this is what you should expect as an outcome. Come see me, and after so many sessions, you'll be cured of your homosexuality. That was never how he promoted it or presented it. Mm-hmm. And right here, we see it. What you're doing has been consistent. It's not like this is a radical change with the work your father's doing. It's just, what I see is now it's more standardized, and you have greater control over who can identify as a reintegrative therapist, so you don't get these actual quacks or right around maligning the name, but it was never actually trying to promote this idea of at least to have this idea of a complete radical transformation or change from gay to straight.
Right, right. That's a good distinction you're making, Andrew. Now, if only big tech would let us talk about it, and so the public would know. So we'll see if this video gets banned, but that's a good point that the public needs to know. I mean, that's a part of the framework of the discussion itself. If we're going to have an understandable, useful, intellectual discussion, and we have to make the distinctions like the one you just made. And we'll see if this video stays up.
Yeah, well, we'll see.